Hi, everyone. Thank you for joining us for the Harmony Foundation podcast series. And I'm pleased today to be joined with Alexa Rich, addictions counselor for Kolmac Outpatient Clinic in Maryland. Welcome, Alexa.
Thank you.
It's good to have you here. So before we get into talking about Kolmac and what services are offered, let's talk a little bit about your background and how you got into the field of addiction treatment.
Oh, I never really know where to start with that question. I feel like when you're in recovery, you have that story where you go to meetings and you hear people have a story. I feel like I have two different stories. Mm-hmm. One's the professional story.
Okay.
On that side, and I mean, really, I am in recovery, and I'm actually an alum of Kolmac. Mm-hmm. I think just different things happened in my life, and then for some reason, I ended up, being faced with recovery at 24, and I found out things like, in a group, someone said, about the obsession after having one drink. And I remember being like, what? Like, isn't that what it's like for everyone? And I just remember just addiction in general becoming fascinated. And I would go to Barnes & Noble after group to, fact check what they were telling me. And I had an interest in art therapy and wasn't sure if I was interested in the therapy part. And just my interest in addiction and then my experience in treatment, because I was not the model patient, was that I really connected to where I was. But I did have an experience, going to an inpatient program where I realized the disconnect, and it really made me passionate about wanting to be, make the field better. And it really, opened my eyes to the importance of engagement, the therapeutic alliance, and individualized treatment where it's not one size fits all. So I was encouraged to do this community college program. I had a bachelor's and majored in art, but I went back to school and I was like, all right, well, I'm interested in addiction, and then I'll see if I like the therapy part, because and so this program got me set up so that I could work as a counselor, and I really liked it, and so I knew I wanted to get my master's. I worked in mental health because I was a big proponent of they go hand in hand, so I worked at a psychiatric hospital as a mental health worker, which is basically seeing everything that happens at on the units. And then I went back to Kolmac, worked as an addictions counselor, went to grad school at Hazelden Betty Ford, and got a master's in advanced practice addictions counseling, and then I ended up back at Kolmac again.
Because you wanted to be home.
Yeah, I guess so. I mean, I feel like I just keep ending up back at Kolmac, and I mean, what I love about the program, and I think that obviously it was a catalyst, I think, for my interest in the field. They have, part of their mission is to leave the field better than they found it. And when I heard that, because I did intern there, I was like, that's exactly why I'm interested in this.
Well, that's a great segue into our next question, which is, Kolmac Clinic is actually a multi-site outpatient program that specializes in addiction treatment and mental health, which is great because it's so important to include that dual diagnosis component. What can a client expect when they come to Kolmac?
So they can expect a warm and compassionate staff. We believe that, the first interest, our administrative staff, I feel like they're as important, as the clinicians. Sometimes they can even be very informative and helpful. We really meet people where they're at. We're very, we use the term patient just because we're grounded in the medical model. As far as expecting clinical services or expect...
just in general.
You can expect clinicians, introducing themselves. It's a warm environment. We basically strive to, treat our patients with compassion. The whole goal is to create a life that, is satisfying without, alcohol and drugs. We are comprehensive. We believe that addiction is a disease. Absolutely. And we, treat both the mental health and the substance use disorder. We believe it's hand in hand. It's our IOP program is 26 sessions over 8 weeks. Generally, patients, if they're coming from an inpatient program, I always say to kind of expect that, the next step's IOP. Sometimes we'll have people coming in and they think maybe, I'm just going to like your outpatient level. But we really want, when you're coming out of that environment, all these different things change. You're not in that safe place. And that's what we strive at Kolmac, because we are outpatient, to create this safe environment in which the conditions to change are there, and it's up to the patient whether they want to take advantage of that or not. Also, the thing is that they seem to connect. I mean, I don't know what it is. Sometimes I think it's like the magic. But, and that's the power of the group that we see, throughout the field. But patients like coming. Good. And I think that, that's one of the biggest things. And, they can expect to be taught the education part, absolutely. We do medication. Our clinicians are familiar with both mental health and addiction. Let me see. So,
what about relapse prevention?
Right. So relapse prevention. When I think about that, I think that that starts from the beginning. Yeah. We do have a model that's part of Kolmac's model. It's a relapse sequence, in which patients are introduced to in the beginning, but they also, if someone does have a return to use, we in group go through that process. And that process is basically based off of CBT. It includes, we believe that the relapse happens before the initial use. We also, if someone relapses, we have, in our continuing care program, we'll have them re-intensify in our IOP program for the extra support. If someone seems to be in a space where they're vulnerable or maybe, feeling shaky, we'll re-intensify them for that extra support, because, if that relapse process has started. We use medication as a tool. We'll, use Vivitrol, we use, anti-cravings, we use Antabuse. We really meet people where they're at. The education about relapse and, especially the medical components of the post-acute withdrawal, and really like in group what our first hour is rounds, and checking in and really identifying those triggers and understanding, what we believe in is that, there's the addiction thinking and then there's the recovery thinking, which is very similar to the stinking thinking in AA. And our relapse sequence, really with that, which I think is really familiar, it's on every wall in every group room. And it, shows that process, but at the same time, it also, the purpose of it is that you're learning to what they, refer to playing that tape through, so that you're able to, when you're looking at this, identify how that process starts beforehand.
That's great. And that's unique to Kolmac.
Yes.
That's great. And so, if someone wanted to access services at Kolmac and wanted to learn more about how they can use your services, where would they go?
So, our admissions line, you can call, and set up an intake immediately.
How about a website if somebody wanted to learn about?
www.kolmac.com.
Perfect. Thank you so much for taking the time to visit with us up at Harmony.
No problem. Thank you for having me.